General bone health, what is important? Regular exercises, especially weight training. காமனாக போன் பெயின் வர்றதுக்கு காரணம் I am Dr. Gokulraj, consultant orthopedic surgeon and joint replacement surgeon.
ஸோ டாக்டர் இப்போ நிறைய பேருக்கு காமனாக போன் ஹெல்த் பற்றி டவுட்ஸ் இருக்கும், அதை கேட்கலாமா?
காமனாக போன் பெயின் வர்றதுக்கு காரணம் இன்னைக்கு today's world is vitamin D deficiency, especially when we talk in terms of நம்ம South Indian population, quite common. ஏன்னா a lot of sun around, but we lack in vitamin D. So vitamin D is no more considered as a vitamin. It is considered as an hormone today because most of the activities of vitamin D is into a lot of things. Especially it also helps in inflammation. It reduces the inflammation as well as it is important for your muscle metabolism as well as the calcium metabolism. So it is considered as an hormone. ஏன் நமக்கு vitamin D கம்மியாக இருக்குன்னா the enzyme, because sunlightலேருந்து நம்ம தோலில் இருக்கக்கூடிய enzyme தான் அதை கன்வெர்ட் பண்ணும். Some of us are deficient in the enzyme, thereby the conversion doesn't happen. So in spite of so much of sunlight, we don't get that much of vitamin D. So body is not able to produce that much of vitamin D. So vitamin D, it can be easily supplemented or you can get it from common sources like milk, eggs and green leafy vegetables can be got. Exposure to sunlight, if your regular exposure to sunlight also is necessary for vitamin D to activate the skin to get more, to manufacture more vitamin D. Vitamin D deficiency is quite common. Next, coming to vitamin B12 deficiency also. So B12 deficiency also is in the rise, and mainly because of poor eating habits. So people are deficient in vitamin B12. So leafy vegetables, fruits, citrus fruits and other things are necessary. If you add it to your diet, you can increase your vitamins. Thereby, both are important for vitamin D and B12. Next, coming to people avoid milk and dairy products, being vegan and other reasons we don't know. But all these things can lead to deficiency. Vitamin D deficiency as well as B deficiency can be there. But in such cases, if you're following a vegan diet or something, you need to take supplements to to have a counter these problems. So this is about vitamin D and B12, which I said. Next, coming to generally increasing the amount of exercise. That is, you need to do, when people beyond 40, surely they need to do some sort of weight training so that their muscles, they start activating their muscles regularly so that it produces the muscles, the blood supply to the muscle improves, and thereby your bone strength improves. And it is important to prevent osteoporosis. And lifestyle, your lifestyle, especially exercises regularly, weekly 3 times, gym training, especially at least weight training is necessary. So this will prevent for sure your osteoporosis, which is going to occur. So it is important that you take care of all these things to get osteoporosis. General bone health, what is important? Important is to be active. You need to be active. Sitting prolonged needs to be avoided. Bending down, lifting weights needs to be avoided. Regular exercises, especially weight training, 3 times a week. At least minimum 45 minutes of walking per day is necessary. Third, your food habits, good quality food, especially home cooked food, along with proteins, better. Avoid anything which is available off the shelf, inclusive of food available from fast foods and other things, because if they're all processed food, they'll surely affect your health in the long term. So better to avoid that. Third is, this is summertime, avoid drinking carbonated drinks, any form of carbonated drinks. Instead, drink at least water, more than enough. You don't need anything extra that, because the extra calories which comes out of the carbonated drink as well as the acids present in the carbonated drink can leach your bone out of your calcium. So these are all things which creates problems, and it is important for us to spread the message so that people are better.